So you go ahead.
I can only work with what I got. Did you hit record on the?
I was about to be here.
Sure did.
I was about to be here 30 minutes late, bro.
First. Sure did.
You know the sad part is? I
You,
didn't believe
you
it.
believed it, I know.
You know why?
You did believe it.
Because you disappoint me all the time.
Wow. That
That's
hurt.
why.
Wow.
That's
Don't
why.
do that.
I'm not mad. I'm
That's
disappointed.
childhood trauma.
That's
That's PTSD.
Not mad at you. Disappointed.
Do we have a, do we have someone I need to talk to someone.
HR.
Zero HR.
We don't
Yeah,
have
zero
one. Chris
HR.
is actually Maddie's the HR today.
Yeah.
Right there is
Actually, this is not a podcast, it's an intervention for you.
Yeah.
All right, Kevin, we need to talk to Who hurt you, man?
This guy wearing black.
Yeah. Who hurt you?
God, wearing black.
This is a really good setup.
Yeah.
Yeah.
This is a very nice setup.
Yeah, I thought we were going to be downstairs. That's why we were downstairs.
Yeah, I thought we
Everyone said it.
in
Yeah,
the
sure.
squat rack.
Should have just talked to Natty. Natty knows this.
Yeah. Yeah. And we're testing out the live format. So
Oh,
on
live.
YouTube, yeah.
Oh, nice.
Yeah.
It's live now?
Yeah.
Then
Been
live.
live.
Then
Yeah.
live.
Yeah,
Okay.
been live.
Okay, nice.
Like, oh, yeah.
The mic is hot.
Mike is hot. Mike is hot.
So
Check, check.
check,
Yeah.
check.
Mike is hot.
Prestige.
World. Wow.
Wow.
This is a wire short.
Yeah, I got it. Yeah, there you go.
I'm just trying not to get it so far.
You wanna check mine?
Yeah, check.
Check his wire.
You didn't check mine. Making sure.
We have a bathroom break or?
No break, dude. We're going.
And we're live already, right?
Yeah.
Yeah. All right.
Alright, great.
All right.
Kevin,
Well,
don't look at the camera. I know this is your first time doing it.
What
Don't look
camera?
at the camera.
we're locking
What
eyes
camera?
the whole time.
Natty, you're good to go.
Yeah.
Who we just
We're just
we're
talking.
talking.
We're
We're
just
just
talking.
talking.
All right, well, let's do it, man. It's been a minute. I think it's Kev's first time.
Kev's first
Yeah,
time.
first time.
Wow.
Welcome, man.
The people in the Philippines will be happy. One of us made it. It's Manny
International.
Pacquiao, now it's Kev.
International.
Honestly, I think I just want to talk about, we alluded before, it's just hamstring injuries, right? I mean, we're all on fantasy team. Nick and I were 1-4,
So bad.
really
So
bad.
Some more than others.
So I just saw Noah Collins on IR, right? A-Chain's about to come back. And I mean, we've been seeing a good amount of hamstring injuries, especially during football season. So
Big one.
let's really talk about why do we think that's happening? Because that's the question we get the most,
Yeah.
right? So let's just riff. What are you guys thinking?
There's so many places to start with that.
Yeah.
It's
We
a
can
lot
start
of
Professor
preseason. We can start
Yeah,
preseason.
Yeah.
preseason, off-season type of thing.
Preseason, I think depends what the guys do off season. I think a lot of times you think about in the off season you just want to rest and recover, but it's actually the worst thing to do
Yeah.
because you're not doing anything. You need to prepare your body for the demands you're gonna have on that field. So I think a lot of times you have to do the little small things that are gonna be leading you up to the season.
Mm-hmm.
So I think one preseason for sure, you probably have not enough being
They don't.
done in the preseason in regards to like volume, prep, demands in regards to like acceleration, top speed. I think biggest thing with like hamstring injuries is because you're not really getting to that high speed often.
Mm-hmm.
You're gonna be more susceptible to when you're getting to those high speeds
Yeah.
injuries.
Yeah, because that volume increases in the
Right.
season.
Yep.
Huge, huge.
Especially even with baseball too. In baseball too, like the off season, they're not really going and then go at it and start running. The
Yeah.
pops.
Yeah,
They're not ready. They were not ready for
I
it.
think for our perspective, this offseason when we work with the guys, especially like on the pro team, I think it was like a lot of volume too.
Yeah.
Right? So it's not a lot of volume, not a lot of rest. And the one thing I've learned this off season is that like when guys are in their facility or whatever it is like they don't emphasize so much on mechanics.
Yeah.
Yeah.
They don't
Right.
really feel it. They don't know what,
Yeah.
what a hamstring feels like either. They're like when even they do deadlifts, it's like, oh yeah, I feel it, I'm doing good, but then it's mostly quads or back.
Mm-hmm.
They don't know how to engage the set of muscles the right way.
Yeah.
So
And
it
I
starts
think-
from there and then builds up.
Yeah, and I think people either, I think from biomechanics standpoint, when we talk about sprinting mechanics, right? Most people tend to go on backside where they're pulling the ground rather than pushing through the ground. So when you're pulling the ground, you're just actively dragging that hamstring and dragging that glutes behind you.
Yeah.
And when you look at guys who are like super fast, like Asian, for example, run super explosive, and you see that, and then volume over time, at some point, it's gonna give out.
Yeah.
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 I think also the thing is like when you're running at those high speeds, you're also increasing your chance for that injury. Because you never see a guy gets injured running 12 miles an hour. You see a person
True.
get injured running 22, 23 miles an hour. So when you get to those higher speeds, it's like almost like directly correlated to the injury rates of how more susceptible you are for that hamstring injury as well.
Yeah.
So I think that's only seeing with the guys like Nico Collins, like A-Chain, Metcalf maybe.
Yeah.
Usain Bolt at the end of his career, he got hurt, a lot of hamstring injuries, the same thing.
Yeah.
Because he's just running so much time. It's like, how many reps does he have under, 22, 23, 24 miles an hour compared to the guys that don't get to those top speeds? You're not really hitting that type of the risk up there.
Yeah. We all seen that show Receiver, right?
Yeah.
So what do you guys think about how they were doing Justin Jefferson progressing back to with his hamstring?
Yeah, I think if I remember correctly, they did a good job of putting him into what it looks like what he's gonna be on the field. So they had a lot of banded acceleration drills, and acceleration we know from courses we've taken that acceleration doesn't really put the stress on the hamstring as much as it would top speed running.
Exactly.
Yeah.
It's all safe to get him back into replicating what he's been doing on the field. So I think they did a great job with the start of that stuff. For sure.
Yeah, I think even just getting to past the acceleration into the top speed, that's where, like you said, the hamstring turns on the most at those phases. So even just getting a little bit of exposure to that area and to that top speed initially for the off season, the preseason, and even into the season in general, that's probably going to help them the most. And, I mean, Jefferson got back pretty good too, and he was able to get back to it.
Yeah, I think the one thing I was nitpicking, and this is me being a dance mom, was I think where they placed the band, it was band resistant up top, rather than the hips. So it was increasing more forward trunk lean rather than increasing hip extension. And hip extension is one of the biggest things that we always teach, right? And when we have
and they're lacking usually.
You're just sitting all day.
They may lift 300 pounds deadlift, but then they don't know how to pop the hip.
Exactly. And then since all three of you guys are professor, right? If we talk anatomy, right? So if you have tight psoas, tight hip flexor, it's gonna pull the what's it called, the pelvis forward, right? And then what happens?
Hamstrings should be technically elongated.
Yeah.
And that position is
So in plain words, it's gonna be the hamstring always gonna stretch, and then you put him a little more to stretch top speed. It's just a recipe for
man on the
man. It's just something's gonna pop at that speed.
Yeah. So let's talk about management, right? So people who listen to this, they obviously now they understand how we're looking at hamstring strain. Let's talk about prevention. What are we thinking?
Prevention, from something as simple as a foam rolling, stretching, but not just stretching the hamstrings, also stretching, but also the activation. I think is what they miss, because they're they can touch the toes, but it's not so much about touching the toes. It's also about having control of the muscle by doing the strengthening. And then what I see and what we see a lot is they're like, oh yeah, strengthen my hamstrings. I'm doing deadlifts, or I'm doing hamstring curls. But then they don't know the hamstring is a long muscle that not just bends the knee, but also works on the hip, like we were talking about that pop of the hip. So they don't know how to do that, and that's the higher up of the hamstring is the part that usually they pops out tears because they're not training it.
Yeah.
Right.
Sure.
That's a great point. I think the biggest thing too is I think usually when you feel something uncomfortable, what is the first thing you do? Stretch.
Yep.
And with a hamstring strain, you don't want to stretch it. Actually, you want to help elongate it and get it used to those stresses underneath that stretch. So static stretches you don't want to really do. You want to do more dynamic stretches. You want to do RDLs, get the tissue used to lengthening. So I think for guys preparation for that, get your hamstring used to the positions that you're going to be doing on the field. So in any positions like an eccentric hip bridge, right? On a physio ball, we do that all the time here. Just working on that eccentric control of that hamstring. Because at the end of the day, when the hamstring works, it's all lengthening and controlling that lengthening position. Under load, exactly. So RDL,
and
we talked about
eccentric is a big one, because I think it's a lot of the guys when we introduce that part, they tend to cramp up because they don't know how to get in that state. But then when they cramp up, then they think it's too much or they don't do it at all. But then that's maybe they need to work within, not to the point of cramping, but tease that point of cramping, be comfortable with the uncomfortable, and then work their way into more of that longer stretch.
I think for the most part, the cramping is probably just weakness that it's trying to do so much, right? And there's no exposure into the elongation, but also the shortening of it as well. So when you're into the top speed, it's the eccentric and then it's the quick concentric of the turnaround, So the cycling of both, after the load is exposed, then we can start to increase the speed at which it's required to lengthen and then shorten as well. Which coiling part of it and the top speed of the turnover. that's where it's important.
Yeah, I think another thing that people might overlook too is like angle range of motion, right?
Yeah.
Dorsal flexion, plantar flexion. You can't get good dorsal flexion. You can't really absorb the load, and then you have to overcompensate. Right?
Yeah.
It's the ground up or the top down. Kev, you do a lot of like iso hold stuff, especially with our patients. So like, what are your thought process of adding in some iso hold exercises, especially to address like the hamstring strain? Nick's already said no static stretching. Right?
Yeah. I think so. Like you said, iso hold. I've seen hamstring strains with the ipsilateral side, the same side, limited hip flexion. So like they're getting to like the hip flexion part of the top speed is not getting in, not high enough. So then the hamstring requirement of at that top speed trying to pull it through even more is more on the one leg versus the other. And I've kind of just like analyzed the athlete I was working with, the running of it. Okay, I did some isos with hip flexion, maintaining proper hip flexion with trunk extension or upright a little more, just to mimic that top speed position, and then work a little more of the iso holds with hamstring into the lengthened ranges and even shortened ranges. And then after a couple weeks of that, we did a little bit of just running the running mechanics and full speed, and then introduced, and he got back into it. It was a track athlete too, so.
Yeah, I think the training people in a proper position that they're gonna be in, I think I can't stress that enough. I think you can do the Nordic hamstring all day. And if you don't go and train into like, hey, here's your front side mechanic, your top speed position, here's where it needs to be, then you're gonna end up pulling it all the time. I mean, like Derek Hansen, he always mentions like you can do so many Nordic, you can do the Nord board and see like you have great hamstring in isometric, but when you go out on the field, you're gonna pull.
Yeah, it looks cool, but it doesn't matter because you're not.
Because sometimes I feel like cool, like, oh, it feels good. Like then I start adding the ball, then it's not something like, I don't know, they make it like so fancy, so unstable, but it still doesn't mean anything at the end of the day. You know, or even something that I'm thinking like something that you've been doing lately, that Nick, is like the force plates. So they don't even know how to, how much of being on different between right and left side.
No, definitely. I'm sure like if we do the force plates, we'll play more around with it. But I'm sure if you do like a hip bridge and have their legs almost extended, you can see probably at that 90 degrees, they'll probably be pretty strong and comfortable because that's probably where they're living most of the time when you do any exercise.
Do you want to explain that more, the force plates though, maybe a little bit?
The force plates, I mean, that's a great thing that we use here. It's a good way to see actual objective numbers there, right? And it's a good way to see how much force the athlete's able to produce. The weight
distribution.
And also accept, exactly. And a lot of times after, certain injuries, whether it's a hamstring, it's an ACL, it's an ankle injury, whatever it is, a lot of times you're gonna just veer away from that affected side. Your body's like almost like pain, I don't wanna go that side, I'm gonna go the other side now. And you can see that weight distribution, which is huge with the force plates. So I think it's really cool. We can dive deeper into that with like now the hamstring
mechanics
stuff,
that
the
we
mechanics. There's so much cool stuff you can do with that. It's,
I think having like tool like the force plate to be able to us identify like, all right, here's where your weaknesses are and here's how we can address it. I think that's huge. Another question I always get was, this is probably 2 years ago, Kyler Murray, hamstring strain, came back through his ACL, right? So people always ask, is that like a correlation, causation kind of thing? What do you guys think about that?
I mean, I think it plays a role, if anything. Just like with an ankle sprain or an ACL injury, if you can't absorb the force got to go somewhere. With the hamstring strain, if the hamstring is weak, it's not going to help with the ACL limiting the tibia moving anteriorly, I guess. That's kind of the thing. I haven't done much research on it, but just mechanics-wise,
definitely.
The hamstring helps with that.
Makes sense. There's a kink in the chain.
Something
has to give. Something's giving, and then something has to do more. So something's probably doing more, and then leads to maybe overuse, fatigue, and then there you go.
Well, I always thought that hamstring, the way I imagine it is always your quads, your hips, that's your gas muscle, right? Your hamstring, your soleus, your antip, those like your brake muscle, right? So if you were talking about your main brakes, which is your hamstring, is strain, right? You're not going to be able to slow down, especially in a fast-paced game. You look at the way Kyler runs, like he's very goal-oriented with the way he runs. He just look, all right, where it's going to go, and then his body's going to adapt. When you have that strain, there's always a delay in the communication from the muscle to the brain or the brain to the muscle, right? And then by the time his reaction speed is going to be lower, and by the time he's all the cut that he used to do on a regular basis, it's going to be a little delay, and therefore somewhere out there, exactly, compensation will happen,
Yeah, but just like we do with all over our ACL protocols, right? When we test them muscle strength with an anemometer, we make sure like, yes, it's not so much about the quad, we also test the hamstrings and see that ratio too, because it plays into the rehab, making sure like, they do have a good ratio between front and back, because like, what's the stopping power. It's not so much about doing big heavy weight with knee kicks or squats, it's about, okay, now can you control also your hamstrings for that position.
Yeah, and so let's talk about how we typically treat hamstring strain, right? Let's say grade 1, grade 2, no tear. What do you guys usually do?
There's a lot of different ways you can start, honestly. I think just seeing what they can tolerate. I think that's the biggest thing. We always use a lot of our patient feedback, see what we can push and teeter that line of, okay, can we push it enough where you feel that hamstring, but is it underneath a pain level, a 2 or 3, and that's fine. At least we're flirting with that. We'll be able to see how you feel with it. I like to start with a lot of mechanics. I'll start with some things we talked about, what you're gonna be doing on the field. So do a wall drill. Can you do a wall drill? Can you do like a simple knee drive and just alternate marching? Does that feel good? Okay, speed the tempo up. See how that feels. Is that still underneath like a 2 or 3 pain level? All right, cool. Let's beat up a little faster. Let's take that off the wall now. Let's do it on the turf. See how that looks. And then,
with a band on the
all the band, yeah. And then after that, just like loading them progressively and just getting that hamstring to understand how it feels to lengthen again and feel controlled as well.
Yeah. So I think I'm big on the ISOs.
Yeah,
at the beginning.
Definitely.
Yeah, because the joint itself isn't going to move, so I can stress it even if it's going to be 10%. I can do 90 on the other for now, and then just teeter off of the 90, go closer to 50, closer to 100, and then eventually, as the person tolerates, then I can bump it up to other things, right? So change the angles of the ISOs, and still get that point where, okay, it's not painful, but I'm flirting with that like 2 to 3 type of out of 10 type of pain level, and then kind of going from there, right? That's a great part to use as subjective info from them, and then apply it to objective info as well.
Yeah, I think along the way, I think we're all very vague on the education, the patient explaining the patient what's happening, so they know they don't go back to this or the habit of the static stretching. Because they may feel because like as we take them through those drills, things are gonna get tight. And or they're gonna be fearful with a little bit of ache. It's like, oh, I'm doing it again, they don't do it at all. So it's like taking, by the way, step 1, phase 1. This is what you're gonna be feeling. This is how you're gonna take care of it with the soreness and all of that. This is what you need to expect on the next stage as we get you to more drills. So instilling that, educational part. It's like a way you need to feel, how you need to manage it for yourself.
Yeah, I mean, when we have one of our pro guys who pulled his hamstring first day of camp, and I think the trainer's either like, all right, we're gonna do nothing, and we're just gonna put on Hivamat and then contrast. And I think all of us can agree that we want movement first. We want to introduce movement as soon as possible. I personally like the fact that we have the shockwave that we can just he's going to find a way to avoid that by shutting that muscle down, right? And now our goal is not to shut the muscle down, it's just to heal the muscle. So how do you facilitate healing? Right, great thing about shockwave is it can penetrate to a deeper layer. Right, recruit stem cell, decrease adhesions, right, and then as scar tissue.
Especially after a tear, every time you tear, there's gonna be like the muscle fixes itself. There's gonna be a little bit of knots. Adhesions are just knots in the muscle that those massages you can only get the top layer. But then really the tear happens like deep inside the muscle.
Yeah, and then it's like once the tear happened, the sliding and gliding is gone. Like the film is not there, so it's like all over the place, right? So.
Definitely.
And that's what we keep seeing. Like, it's like it keeps happening. It's like, oh yeah, it happens in the same place, It's like so less and less of that contraction happening.
Do you remember when we had one wide receiver coming off high school, going to college? He has so much quad adhesion that we couldn't literally get the needles in because there's so much chronic.
No way.
Yeah, like hip strain, right? Hip strain. You remember that?
Yeah, I remember. To use as some magic, some like
Dark arts.
Dark arts there.
Going back to the books, I'm like, how am I gonna get into this muscle?
No, because I feel like we don't talk a lot about scar tissue when it comes to trauma.
But he probably got into the whole rest. It's like a rest, let it rest, whatever. But he got into the bad habit of not doing anything, but see what not doing anything does.
Exactly. I always tell patients like after an injury, collagen's gonna lay it down right
Yeah.
away. So we have to manipulate the collagen to help with the healing process,
Yes.
continue it, right? Because shockwave and our manual stuff will help with the laying of it,
Yeah.
because it's gonna lay it regardless. Body's gonna lay it down.
Yeah.
And then through exercise, we can manipulate it that way as well.
Yeah, it makes sense that you bring up collagen because if collagen's gonna lay it down, like you want to have a good foundation, right? If it's all crooked and collagen gonna go on top, now not only that we have to manipulate the collagen from the superficial layer, now we have to like work through that and then work through the next level and then work through it again until you go back to it can cross.
A smooth
extremely-
surface.
Yeah.
Yeah, because the proactive part of it will help us in the future versus waiting 2 weeks. That's 2 weeks of collagen laying down.
Yeah.
You know, so now if we're proactive, we could beat that initial kind of like pain part. You know, so.
Yeah, and I think another thing too, pain tolerance wise, right? What do you guys think when a patient or an athlete's going through their rehab? What should their pain tolerant level should be? Because you can't just do rehab with zero pain.
Yeah.
Right.
Like Nick said before, like like 2 or 3,
Yeah.
feeling a little bit of discomfort. Of course, as long as with that little discomfort is not increasing with every repetition.
Exactly.
Repetition number 8, they're like, oh, my pain is 8. I was like, maybe let's modify it.
Yeah.
Let's try it a different way. Let's see, like, because depending on the athlete, maybe, your O-line versus a wide receiver, like, let's find it at a different angle, see how we can work that fiber.
Exactly. I
Yeah,
think
different
education too, like having them expect that there's gonna be a little pain.
Yeah.
You know, I think that's the biggest thing we always tell patients. Like PT is, it's not fun sometimes. It's nitty gritty. But that BFR cuff, no one likes to do BFR. I mean, sometimes Natty does. I mean,
Good. Everybody gets
yeah. Everyone gets
Legs and arm at the same time.
Yeah, that's it.
Yeah, literally. But yes, it's hard. It's a hard process. So that's what we gotta do. We gotta push you to that point of like that teetering line we talked about before, to make you get to that end range so that you're able to. So that when you get on the field, you've already gone through the hardest part of your recovery. The field stuff should be the easy part, and you're ready to go.
Exactly. Since we're controlled in our environment, we can manipulate that part at least, because when we're on the field, like I said, it's like we don't know what's gonna happen.
Yeah, chaos.
Yeah, it's literally chaos.
No, I think introducing the BFR is so great because,
BFR.
like, I mean, just mentally speaking, right? Like when you're an athlete, you're sideline. You're like, man, like I'm missing out. I'm losing muscle. Introducing like the blood flow restriction, get the blood flow going, right? Get a good, muscle pump, so that way you don't have any atrophy, right?
Yeah.
What was the average muscle loss with bed rest?
It was something
30%
crazy. It was like
or
30%
something.
within like 24, 48
Yeah.
hours.
Yeah.
Like 30%, literally,
insane.
just muscle is just gone.
Yeah, so I think having the discovery and the utilization of BFR have changed the landscape of how we do PT in general.
Oh, definitely.
Yeah, that's what the point I was gonna make. So like when the pro guys injure his hamstring, shockwave, needle, and BFR, and then like their counter argument was like no BFR, no active movement. I'm like,
They're afraid of the stress on it, but I think we were talking about it this week, that like the different fibers of the BFR, remember?
Oh yes, yeah.
Oh, yeah,
I just
yeah,
listened
like
to
type one,
the I
type
just listened
two,
to the
right?
podcast
That's
about the guy that
Star
started all his
fibers and the
recovery.
fast
yeah,
About how like your BFR is kind of recruiting all muscle fibers. So then it depletes the oxygen to those low twitch, like those low twitch fibers, to where the spastos have to help out. You usually don't ever get that until you're working like high loads, high demands, right? So that BFR is able to simulate that environment as much as possible very early.
Without stressing, really
Without stressing the
stressing.
joint, yeah, exactly. I think honestly, people just doing BFR like we do it regularly here, just because it goes to joints. You don't have to load those joints as much, and you can still get the muscles to feel that fatigue and feel that that environment. So I think that's great. I think really good.
yeah. Johnny Owens talked about that, and he was like, if you get muscle under fatigue,
Yes.
you're gonna get a cellular stress,
Yes.
which therefore will then send signal to the brain to release as much growth hormones as possible.
To keep up with it.
I'm like, this is a hack. Like I'm yeah. I was like, we have to utilize this as soon as possible.
Yeah, for
Like
sure.
even someone with stretch fracture.
Mm-hmm.
Talk about
We
that,
were talking about that before,
right?
Yeah.
Because like back in the day, stretch fracture is just rest, lay.
Yeah.
Guess what? 30% of your muscle
30,
mass is gone.
and it keeps
Yeah.
increasing.
Yeah.
Then the muscle atrophy, you see like the muscles are actually just shrinking.
Exactly.
Mhm.
They lose control of it, they lose feeling of it.
I mean, look, we got a new patient 3 weeks post-op ACL. His quads look phenomenal.
Yeah.
Really
Like
good.
yesterday, and like Danny was showing me, I was like, man, like he looks like the 3 weeks that we get now
Yeah.
look like what a 6 week or an 8 week
Yes,
used to look
for
like.
sure.
And it's crazy.
We have another one too that he is about 6 weeks, and he was telling me the other day, like he was talking to another classmate who had like about the same. He's like, "Whoa, look, your quads looks massive," and he's only 6 weeks out.
Yeah.
Compared to like the other guys, like yeah, like he's like they keep at it, but they never use BFR. They never, they still, you can see the facility or like how
Yeah.
muscle loss.
There's something missing in that part, right? The BFR is gonna cover that missing piece of improving the blood flow, hypertrophy, limiting the atrophy, and then getting that 90% of that muscle twitch to get some gains there.
I think what really sold me was when they were saying when you use BFR, you get all the motor control recruitment. Like, cause like literally, like your motor neuron has to fire because it's under fatigue. So I kind of veer away from using electric stem to get quad to fire.
Yeah.
So I'm like, if it's under fatigue, you are grinding to get that quad.
Your body
The
is
ether
like
has to
fight.
go through the skin, through the fat, then to the muscle for the brain to perceive that information, and then with the fear, we're just creating that environment so fast that it can just get more out of it.
Yeah, from like an education standpoint of getting people to feel their body again, I'm huge for
But
sure.
especially I think that comes into the hamstrings that we were talking about from the beginning is like patients having a hard time feeding the hamstring, working the hamstring, but with the BFR we can get it to that state without the cramping, because for all of us when we do any workouts, it's like we don't that cramping feeling on the hamstring is just horrible.
It's hard.
It's like
It's
I don't want to go.
Yeah.
And then we can get that feeling, but without stressing it, without putting so much weight on it so fast, out of controlled environment.
Exactly.
Yeah, I think another thing's good too, because the muscle's under fatigue, it's gonna recruit what it used to recruit, which might not be the right muscle. So you get to educate, like, hey, no, you should feel it this way.
Exactly. So along with the physiological change, we get the neuro re-education change, big on that. So then that's also part of that loop of physical therapy.
Yeah, I think it's a good point. Like when we make them BFR with the bridges, everyone does bridges. But then I was like, oh, what are you feeling? It's like, oh, I feel a good burn. I'm like, okay, where? Oh, quads.
Like
You should not, you shouldn't feel the quads when you do bridges. It's like, wait, what? And then that's, I'm sure they do bridges with so many years, but now the education part was like, hey, maybe you should feel it in the hamstrings and butt muscle and core.
I think another thing that we might miss in like the sport performance world is history of back injury, right? With hamstring weakness, because we're talking nerve root, right? So I mean, how do you guys, Kev, you do a lot of low back manipulation, all that stuff. Like, what's your way to assess whether the hamstring is firing appropriately, especially giving someone with like low back pain?
I usually clear the back out first. Like I'll check the back and assess it, whether it's a active assessment, and then passively, and then even some unilateral posterior to anterior mobilizations there, just to see what's going on, right? If that's going to reproduce some low back pain, that'll just give me a signal of what else I need to treat, what part of the treatment session I can address, right? And if they have some mobility issues in the low back segments, then okay, manipulation, see how that feels, continues that, because then that'll just set up a cascade of events into the neuromuscular system to help with contraction in the lower segments too, so that's kind of the thought process.
Yeah, and I think like when you have those soft tissue injury, to go directly to like a sport massage therapist to just address the soft tissue, you might end up missing some of those components, especially the nerve root stuff. Right? I mean, you're teaching the cadaver lab now, both of you guys. So like when you're teaching like the future PT student, like what are you telling them when it comes to like looking at the nerves and all of that stuff?
It's all connected.
Yeah,
I think it's cool. Like I think going to the cadavers and looking at the sciatic nerve and how big it is, you're like, wait, that's the nerve? Like, it's like a muscle. It's ginormous. So it's really understand like that has a huge influence on the rest of the leg now. So if that's inflamed at the nerve root level, you can understand how that's going to send a huge signal down to the rest of your leg. And that's going to be, vice versa. I think that's definitely a huge thing. And now Danny's been doing a lot of needling at those nerve roots as well, which I know that's a huge thing where we're able to stimulate that nerve root that's been going through that chronic pain for such a long time, and it's been pretty much shut down. If you're able to wake that up, it's going to help so much later on as well.
Because the compensation we were talking about, like, the body will be able to adapt, especially as an athlete. They know how to adapt so quickly.
Exactly.
And then, a repeated injury to the hamstring, going at it, and then, something is going to have to change. So the body just adapted to a different way. So now if we get to where the hamstrings start, at the level where they start in the spine, open it up, open the blood flow, open the signal from the spine into the muscle itself, get it to fire, combine the BFR, combine all the stuff, the ISO, some nips, get them to everything to integrate.
Yeah, and I think that's why we always highly recommend people who even if they're not in Jersey, is like seek out like rehab professional like PTs, because you want to rule all this thing. Yeah, especially like you want to rule all this thing out
For sure.
because like you might pull something, but that just might not be it. That just might be like the straw that broke the camel's back, but not really all the history of what's going on.
It's a piece of the puzzle, but it's not the whole thing. So.
Yeah. So, all right. Last question. I sent you guys this text this morning of this new brace that supposedly that you wear this knee brace supposedly when you're about to go into a dangerous position or a position that put you knee at risk on tearing ACL. There will be a little mini airbag deployed, like milliseconds before it happened. What are we thinking about this? Is this a marketing scam? What do you think this is?
A big marketing scam,
Yeah.
for sure.
I'm thinking, remember like when there was a crisis with airbags in cars? There's gonna be a crisis or airbags now in braces.
Yeah.
Oh my god,
I know.
yeah, I can imagine that. I feel like I walked down the stairs wrong when airbag
Yeah.
deploys.
Yeah,
Well,
exactly.
No, but I think this is a good point I was actually gonna bring up. You mentioned before with fear, and I think our PT student Liz is gonna do that. Shout out to Liz.
Yeah.
Kinesiophobia, and now just make people scared of movement because also now I'm scared to move this way, and then you also now have a safety net of an airbag deploying.
Exactly.
So I think that's the biggest thing we want to veer away from. I want you to be confident with your movement, be comfortable with movement, not have to depend on something secondary to have to help yourself.
Yeah, I think like if you have someone like hypomobile athlete like Mahomes who makes wild play and his knee going to crazy positions,
It's gonna start popping.
it like I feel like it's gonna does more harm than good.
Yeah, that's what makes him
Exactly.
great. He's able to get in those positions and control it and then make plays out of it.
Mhm.
So
Yeah.
But you make a great point. It's like like teaching the athlete how to be in those extreme positions without injuring. That's not much. Just like exercises. Like let's teach you how to be in that almost falling position and having control of that position
and not be scared of it.
and not be scared of it.
What do you guys think? This is just for fun. What do you think is the biggest marketing scam you guys have seen so far when it comes to like sport performance?
For performance.
Shake weight.
What sport?
Okay.
The one on
Yeah. These guys say shake weight. No thinking. He just goes.
That was automatic. I think we were talking about that the other day with somebody. That's why. We were talking
No,
about
I
shake weight.
think of those the old school basketball shoes with like the little disc in front.
Oh yeah, yeah.
And
to
it
get the
forced-
calves
Yeah.
Those didn't work.
So it's like a you're still wearing them.
I was still wearing it
With
the
your
next
shake weight.
day, actually. Yeah.
With the shake weight.
With the shake weight, the moon boots or something like that. Oh, I definitely had those as a kid.
Oh,
I was like
man.
13 years old, I was walking around like high heels pretty much in the house. Like, okay, I'm just trying to bounce.
That's funny.
My
Let's
vertical
see the calf.
That's it,
Let's see
all
the
started.
calf.
Yeah. Rubber ducky socks here.
Yeah.
That's it all started.
That's a bad one. Yeah, that's a bad one.
No, that one is yesterday one of the patients talking about that insole.
Oh, the carbon fiber one?
Yeah.
Yeah. I don't know much about that. I
I
just don't think it's gonna work.
don't see how it would work.
No.
You know, supposedly they claim to add like 2 inches to your vert, but that could just be a placebo.
Yeah.
Yeah.
You know?
But you know what I've seen too, a lot of now people can just buy it on Amazon, like the either like a knee brace, shoulder brace, something with e-stim and heating, and then you can
Oh,
go
yeah.
Or like the
a
hyper ice.
hyper eyes, or even like something with portable now. Because before it used to be only medical, but then now the claims like, oh, this is gonna solve your issues.
Yeah.
Like, is it?
Have you seen the cupping one with the infrared laser?
Yeah,
Yes.
I did see that.
One of my friends ended up doing it, and he texted me. He was like, "Yo, what is this? Look, send a picture." I'm like, "Dude, it's a blister."
Oh.
Yeah, it blistered up bad.
Nice.
Wow, so you got
Yeah.
like burn.
Yeah.
Wow.
Sheesh.
I said, you gotta take
See,
care of
that's
that.
what you
Yeah,
get.
take
for-
care of that.
Yeah.
Yeah, that's pretty nuts. I think this morning we're talking about Nike developing a cleat
Yeah.
like that's supposed to help prevent ACL. I don't know much about that. I just heard.
I remember reading something about that.
Yeah.
It was they marketed it as like a ACL prevention or like
Like a cleat.
it was
You know.
prevent your
They're probably
tear.
gonna charge a lot.
Oh,
Well,
definitely.
for sure, they're gonna charge a lot. If
Yeah.
if cleats already expensive, they're gonna charge
Mhm.
triple. but then shame on them, kind of telling them.
I think this is just like one of those things where like people get so good at marketing, they just like, all right, let's just slap this on as a solution.
Yeah.
I mean,
We'll get someone to bet on that.
Yeah.
It's clickbait. That's all it is.
Oh yeah, it's like one of those
Bidding on the
TikTok
fear.
buy.
Bidding on the fear.
Yep.
Yep.
Yeah, like I think like prevention in general, I think having adequate rest, right? Nutrition, also understanding like growth spurt. Like you like when that's when most tear would happen.
Yeah.
Most injury really.
Most injuries,
because,
really,
Like when you're taller and your body's going, I would say like when kids get like 3 to 4 inches taller, it's like now they're running on high heels.
Yeah.
It's not the same.
Yeah, the body's not adapted to like the new size.
I have no idea what to do.
And that's why I think resistance training, strength training is probably the best insurance policy,
Sure.
right? Adding isometric in there and all of that stuff. So I think that's gonna be huge. Well, before we wrap this up, let's see. This is just off the cuff. What do you think the biggest upset this week gonna be for an NFL game? Let's see.
Oh.
Seahawks beating the Falcons.
Oh,
Yeah.
really? I like that.
Yeah.
So
I
that
think
I like that.
I don't know if it's upset, but I think the Jets.
So apparently
I think
you're a
the Jets
Seahawks
this
fan
week.
now, right?
Yeah.
Apparently.
A Seahawks fan, yeah,
Apparently.
yeah,
For the last 2 weeks,
Yeah. I think
Jets beating Steelers.
I think Jets beat Steelers this
Ooh,
week.
yeah,
I think the
that's pretty
whole
good.
thing with Tay
The
Adams
vibe.
now.
Yeah.
I think the
It's a
vibe is
statement.
good. It's going. Last week they should have won, but it was like
Giants beating Eagles this week or no?
no way.
No.
I'll be there. It happens. I'm running on the field.
Yeah.
I'm
wanna see it, we're
blocking
guaranteed.
Yeah, that's it.
You said it,
You said it, you
said it.
Yeah, bail me out Monday.
All right, man. I say Jets. I say Jets over Steelers.
Yeah.
Definitely on the road.
Think
Road
they got it.
warrior it
Think
out.
they got
I
it.
like it. I like
Yeah,
it.
it's gonna be a big statement.
Yeah. All right, guys. Well, great time, and then let's do it again.
Yeah.
All right.
What's up, guys?
Nick, we're good.
Thank you.
Good job, Kev.
Appreciate it.
Wow. Up the chair.
Yeah. This guy's
With the
saying
shake weight.
The shake weight is crazy, bro. Guys say shake weight.
I'm not gonna say.
Body blade.
I was say no Diddy.